Hello everyone, this is Dr. Manjusha Kuruwa, dermatologist from Spur Derma Center, Mulund, Mumbai. I am glad to share with you what is fungal infection, how to prevent it and how to lead to a complete cure. With global warming in last few years, we are observing a steep rise in number of cases of fungal infection all across the world, especially in hot and humid countries which are overcrowded. The self-medication and use of steroid creams have led to widespread epidemic all over. Fungi are the organisms which are normally present in a body without harming us. But when there is climatic change in hot and humid climate, they grow rapidly to form what is called as ringworm. Ringworm can affect any part of body right from toe to scalp. When it affects the feet, it is called athlete foot because it is common in athletes and sportsmen. It is also common in people who are indulged into wet works like housemaids. The most common form of fungal infection is Tinea cruris, which is seen in upper and inner thighs or groins because of the tight clothes and humidity. As I said earlier, it can affect face, chest, back, hands, feet and nails. Nails are major source of infection of spread from one person to another as well as the self-spread. When it occurs in softer tissues like mouth or vagina, it is seen as white flakes. Fungal infections are common at any age. We are seeing more cases even in childhood nowadays, and up to older people are also very prone for fungal infections. People with low immunity like diabetes, people on steroids, immunosuppressants or anti-cancer drugs and kidney diseases are more affected with fungal infections. The obese people and thyroid problem people, they are also more commonly affected by ringworm because of excessive sweating. It is also common in people who commute regularly in overcrowded public vehicles. How fungal infection can affect one's life? Fungal infection can lead to intractable itching all over or other patch. It leads to lot of sleep disturbances and irritability. People come to us saying, "Doctor, कुछ भी कर दो, लेकिन हमारा खुजली बंद करवा दो." It's not uncommon. You imagine yourself in some funny situations that you have fungal infection, you are in front of the boss or you are in a meeting and you have that desire to scratch. Such incidences are absolutely not uncommon nowadays. It affects your quality of life. It affects the sleep and lead to irritability and anxiety as relapses and recurrences are common. The spread in the family members is also very common. So there are some easy preventable factors which one can follow. Please do not wear tight synthetic clothes like jeans, jeggings and tight underclothes. Wear loose cotton comfortable clothes which can dry easily. Have bath twice daily if you are sweating excessively. Dust your body fold with antifungal powder to prevent spread and occurrence of fungal infection. Do not share soap, bed linen and towels with anyone. Use a separate soap in the households. Use the creams or recommended medication to the maximum proper level and avoid going to the pools if you are suffering from fungal infection to avoid the community spread. Avoid the locker rooms as well. Now we come to the treatment part of it. First and foremost, what people do. Unfortunately, it's very common that patients go to medical shops and do the self-medication in the form of ointments which are with the suffix or prefix like BG, B, Mixi, Total, Derma and Plus. These all contain steroids. Initially, they definitely give you some symptomatic relief, but lead to a spread at a very rapid speed, as well as it can lead to some permanent damage of the skin in the form of redness, stretch marks and atrophy, which is sunkening of the skin. So you visit nearest dermatologist for a proper course of treatment. Earlier we used to see difference in fungal infection within few days, but because of the fungal resistance, it's so common that we have to treat patient at least for 6 weeks and as long as 3 months. So even if there is good relief in itching, it's not the end point of treatment of fungal infection. You have to take proper dosage for proper duration as recommended by your dermatologist. Dermatologists are people who will give you rational medication for proper time and see to that the relapses and recurrences are not there. So please visit only your dermatologist. Thank you so much for watching this video. Please like the video and subscribe it. Thank you.